Today we'll be considering 12 bills for markup. Of these 12, I'll be asking for unanimous consent that we consider 8 of them en bloc, 1 with offered amendments, and all of which we discussed at the subcommittee's legislative hearing on March 21st. I'll also be asking for unanimous consent to consider 10 lease resolutions for VA facilities en bloc. I'll be supporting most of the bills on today's agenda and look forward to addressing our policy concerns and working with the minority to amend some of these bills, either today or later at our full committee markup. In accordance with committee rules, the subcommittee has contacted the Congressional Budget Office seeking informal preliminary cost estimates for each of these bills being considered this afternoon. While many of the bills on the agenda will most likely have a score, we do not have cost estimates for today's markup. I want to apologize for being late, and I appreciate your indulgence. Our bill list today addresses concerns that veterans and stakeholders have brought to the committee's attention, to include my bill, H.R. 3584, Veterans Care Act. My bill proposes research on non-opioid pain relief options for veterans with chronic pain and PTSD. I want to emphasize that this bill is intended solely for research purposes. Gathering more data will enhance our ability to effectively treat our veterans. Many of the concerns that these bills address are bipartisan, and I seek to work with my Democratic counterparts to address them. With that, I now recognize Ranking Member for any opening remarks she may have.
Thank you, Madam Chair. I was glad to discuss many of these bills at our legislative hearing last month and appreciate that we are moving quickly through regular order on several bills that will improve access to care for veterans and improve VA infrastructure and resources. I was very moved to hear from Ms. Brittany Elliott at our legislative hearing on the impact of H.R. 6373, the Veterans Spinal Trauma Access to New Devices, or Veterans Stand Act, which would have for her, the impact it would have on her and veterans like her. I'm proud to be co-leading this bill with Representatives Bergman, Bost, and Dingell. As we discussed at the legislative hearing, H.R. 6373 will codify VA's existing policy of providing annual preventive health assessments for veterans with spinal cord injuries or diseases, and increase veterans' access to state-of-the-art assistive technology known as personal exoskeletons. During that hearing, Ms. Elliott shared her moving story about accessing this technology and what it has meant to her life, and I'm glad to see this bill move further through the legislative process. I look forward to continuing to work with my colleagues to support these amazing advancements in technology to help paralyzed veterans lead the lives that they deserve and the potential of their lives. I'm also pleased to support Representative Underwood's H.R. 3303, the Maternal Health for Veterans Act. This bill will require VA to report annually on activities related to maternity care coordination. This report must include data on veterans' maternal health outcomes along with recommendations for improving them. Further, this bill authorizes funding through fiscal year 2028 for VA's maternity care coordination program. I look forward to voting to advance Ms. Underwood's bill. I'm also looking forward to supporting Representative DeLuzio's bill, H.R. 3225, the Build for Veterans Act, which aims to improve VA's capital, asset management planning, and investment processes. On average, VA medical facilities are 60 years old, and currently VA has a backlog of infrastructure projects amounting to more than $180 billion. Representative DeLuzio's bill will require VA to develop goals and metrics to assess the performance of its capital asset management program so that we can ensure limited resources are being directed to the most critical needs. It will also mandate independent reviews by the VA Office of Inspector General and the Government Accountability Office. I also support Representative Dingell's bill, H.R. 5794, the VA Peer Review Neutrality Act, which was introduced in response to a disturbing situation at the Detroit VA Medical Center involving the manipulation of peer review processes. Representative Dingell's bill would build upon important lessons learned from this situation and help reduce the risk of such wrongdoing in the future. I'd like to take a moment to share some thoughts on the chairwoman's bill, H.R. 3584. the Veterans Cannabis Analysis, Research, and Effectiveness Act, which will be considered as part of the en bloc. It's clear that this is an area in which we need additional research. I think it's important. It's an important topic, and that this bill should move forward today. However, in its testimony at the legislative hearing, VA offered some suggested changes that I believe would improve the bill. In particular, I agree with VA's suggestion to amend the bill to allow the department to convene subject matter experts from the VA and other federal entities. Allowing VA to coordinate with other agencies will strengthen the research and our understanding of the effects of cannabis compounds. I would also suggest that we accept VA's suggestion to require it to determine the feasibility and advisability of establishing patient registries to support research. I hope that the Chairwoman will be willing to work with my staff and with VA to amend the bill as appropriate if it is considered by the full committee to ensure it is as effective as possible at driving this research. I'll stop here and just close by saying I look forward to marking up these bills today and continuing to work with my colleagues on both sides of the aisle to perfect some of these pieces of legislation between now and when they are considered by the full committee. Thank you, Madam Chair, and I yield back.
Thank you, Ranking Member Brownlee. I now call up H.R. 3649. The clerk shall report.
H.R. 3649, to direct the
The
Secretary...
bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. I will now yield to Ms. Brownlee for a statement.
Thank you, Madam Chair. Unfortunately, I must oppose this legislation today. While I agree with Dr. Murphy that we should be pursuing effective treatments for PTSD and TBI, multiple reviews by both VA, DOD, GAO, and others have found that the scientific literature simply does not support hyperbaric oxygen therapy as a clinically indicated treatment for PTSD and TBI. According to VA, it may even be harmful. I also have some concerns about the funding mechanism. This bill would effectively set up a GoFundMe for a scientifically unproven treatment, and I'm concerned about the precedent this would set for other controversial, scientifically unsupported treatments. It could also set up VA and Congress to have to directly fund this care in the future if demand for the treatment exceeds the amount of donations received. Finally, I share VA's procedural concerns about how this HBOT program would be administered entirely through community providers and how the department would have to set up an entirely new referral, scheduling, and follow-up process for this program, aside from the existing community care processes. I know Dr. Murphy is passionate about this, and he has advocated for this legislation for many, many years, including by offering it as an amendment at past committee markups where it was not adopted. I cannot support this legislation, and I urge my colleagues to oppose it.
Thank you, Ms. Brownlee. Do any other members wish to comment on H.R. 3649?
Madam Chairman.
The chair recognizes Dr. Murphy to speak on his bill, 3649, for 5 minutes.
Yeah, thank you, Madam Chairman. I'd like to speak in support of 3649, the Veterans National Traumatic Brain Injury Treatment Act, which requires the Department of Veterans Affairs to implement a 5-year pilot program to furnish under the Veterans Community Care Program hyperbaric oxygen therapy to veterans with traumatic brain injuries or post-traumatic stress disorder. I will firmly say that I understand that some individuals within the rehabilitation community do not agree with this, but I'll also say that many individuals do not agree with psychedelic treatments also. This pilot program be set up in 3 separate VISN for 5 separate years. In North Carolina, a 2021 report by the North Carolina Community Foundation of NC East to the legislature showcased an impressive number of successes through the HBOT program among North Carolina veterans. The bill is bipartisan. We have members on this committee also in a bipartisan manner to help with this. I will tell you this, that in the quest to try to cut the number from 22 down to each veteran deserves a chance to reach out to a particular program, especially since it is not funded by this government, for sake of relief so they do not commit suicide. I am an objective scientist. I do not believe in treatments that should not be offered that, in my opinion, do not work. I would ask that it also be noted that the American Legion, AMVETS, Vietnam Veterans of America's Fleet Reserve Association, multiple organizations are in favor of it. It is beyond me why the veterans, in their infinite wisdom, will not allow veterans, the VA in its infinite wisdom, would not allow veterans to seek yet another treatment that possibly could save their life. Recently, a keynote speaker for HBOT were over 300 individuals, many of whom were successfully treated with HBOT attended. Prophet called HBOT for Heroes. It was an excellent event. I would not speak in favor of this treatment if I did not believe in my medical opinion that it could help save the lives of veterans. Thank you for your consideration. I'll yield back.
Do any other members wish to comment on H.R. 3649?
Madam Chair.
The chair recognizes Representative Van Orden for 5 minutes.
Thank you very much, Madam Chair. I have friends who are combat veterans who have personally benefited from these treatments. Some cases they had to pay for them out of pocket. In other cases, there's charities that have been established. And my friends are here. I can pick up my phone right now and call them. I can call them and say hi because they haven't committed suicide. And to me, that's incredibly important. It's a very personal issue, and we're going to talk about this later, including one of the bills that I hope you all support. We have to do something different. We have to. We've got, what, $120 billion into the VA for suicide prevention since 9/11, $16.5 billion this year alone for suicide prevention, and our veteran suicide rate is increasing. And if we can prevent one veteran from committing suicide so we don't have to go to another funeral, then we should do it. Because what we're doing and all the scientifically proven treatment modalities that the VA is using are not working. And we can quantify that because our veterans' rate of suicide is increasing. And so I respect you tremendously, Ms. Brownlee, and I would ask you to very thoughtfully reconsider your position. Because, again, I can call several of my friends right now and tell them I care about them deeply because they're still alive and they benefited directly from HBOT therapy. And with that, I yield back.
Madam Chair.
The chair recognizes Representative Luttrell for 5 minutes.
I understand, Ms. Brownlee, I understand exactly your perspective, and I think if I'm scaling this right from the research that you've probably been given, the hyperbaric oxygen therapy when it comes to post-traumatic stress disorder, but traumatic brain injury, is 3 different siloed cognitive instabilities. Is the issue specifically focused on the fact that post-traumatic stress disorder and post-traumatic stress is in the language? Because hyperbaric therapy has been proven to address traumatic brain injuries, which their cognitive issues run parallel with post-traumatic stress, and it's often misdiagnosed. And I'm not asking to make any changes per se in the research. My curiosity is the effectiveness for HBOT in that specific space is important. I'd hate to see us lose the opportunity to treat. And when it comes to post-traumatic stress and post-traumatic stress disorder, those quantifiable tools in the proverbial toolbox are very different for each individual, because you could have 20 of us in the room and 10 of us would be successful in our therapies over 30 days for post-traumatic stress, because there can be a catalyst in there that's associated with all 3 injuries, because if you have a traumatic brain injury, most time you have post-traumatic stress. I'd hate to see us kind of walk away from a leading edge or a kind of a progressive effort in this space because it is so undefinable at times. I don't necessarily know if I had a question there or a statement. I just wanted you to hear me say that as a neuroscientist. Thank you, Madam Chair.
Can I just respond?
The chair now recognizes Representative Brownlee for 5 minutes.
I hear what 2 of my members are saying on this, and I think that this particular treatment is good for certain things. I just don't think the science is there for these applications. And there are some who believe in the scientific world that it could be harmful. the possibility of it being harmful. So I think it's good for ear and sinus pain, for middle ear injuries, temporary vision changes. Those are some of the risks involved, including lung collapsing, which is rare, but it does happen. So I hear what you're saying. I'm not going to change my position today, but I hope we can work it out. Thank you.
Does any member wish to offer an amendment to H.R. 3649? Hearing none, I now recognize General Bergman for a motion.
Madam Chair, I move that the subcommittee favorably forward H.R. 3649 to the full committee.
There is a motion to favorably forward H.R. 3649. All those in favor say aye. Aye. All opposed say no. No. In the opinion of the chair, the ayes have it, and H.R. 3649 is favorably forwarded to the full committee. I now ask unanimous consent to consider the following bills en bloc: H.R. 3584, H.R. 4424, H.R. 5530, H.R. 6324, H.R. 6373, H.R. 7347, H.R. 3225, and H.R. 5794. Hearing no objection, so ordered. The clerk shall report.
H.R. 3584, to direct the Secretary of Veterans Affairs to conduct...
The bills were circulated in advance pursuant to committee rules. I ask that the reading of the bills be dispensed with. Hearing no objection, so ordered. Before I open the floor to other members to comment on these bills, I would like to say that there are a couple of bills that we will need to amend at our full committee legislative hearing. I look forward to continuing to work with the minority, the VA, and other stakeholders to address the concerns raised at our legislative hearing and amend certain bills to ensure that we are putting forward our best legislation for our veterans. Does any member wish to speak on any of the bills en bloc? The chair now recognizes Representative DeLuzio for 5 minutes.
Thank you, Madam Chair. My bill, the Bill for Veterans Act, is a common sense piece of legislation to modernize and streamline delivery of VA medical facilities and other infrastructure projects, bolster VA workforce, and save public money in the process by speeding up the disposal or repurposing of unused and vacant buildings owned by the VA. It is very badly needed. Across the country in many of our districts, the VA opens dozens of new remodel facilities each year, but the need for more modern facilities is much greater than VA's current speed, budget, and ability with the current workforce. On average, VA facilities are 60 years old, and the VA currently has nearly $180 billion in backlogged infrastructure projects. This backlog continues to grow faster than VA can address it. This bill builds off the historic infrastructure investments coming out of Ranking Member Takano's PACT Act, and specifically the Build for Veterans Act tackles workforce issues by creating a staffing model to ensure a base level of capital asset staffing and through new recruitment and retention incentives. It streamlines infrastructure projects by requiring VA to implement a more concrete schedule, and the bill ensures there are adequate offices and staff to more efficiently manage capital assets. Finally, there's an oversight section of the bill requiring VA to provide an annual budget for Congress to monitor plans, performance data over a 10-year period, and make sure good progress is being made. My bill is supported by many VSOs, including VFW, DAV, PVA, Legion, IAVA. It's a good bill. I hope my colleagues will choose to support it. Thank you, Madam Chair. I yield back.
I now recognize Representative General Bergman for 5 minutes.
Thank you, Madam Chair. Before I discuss my legislation, I would like to start briefly by mentioning my support for 2 bills that are also included in this en bloc. First, the Veterans Peer Review Neutrality Act, which I was proud to join Congresswoman Dingell in introducing. It will take important steps to prevent conflicts of interest and ensure that there is accountability at the highest levels of our VA medical centers. Secondly, I'd like to thank Congressman Van Orden for his bill to require VA to make a formulary determination for psychedelic therapies within 6 months of FDA approval. These therapies have a huge potential to help us address the mental health and suicide crisis among our veterans, and any VA red tape that delays a formulary decision could cost lives. Both are important pieces of legislation, and I'm glad to see them included in this en bloc. I'd now like to focus on the Veterans Stand Act, which I introduced along with Ranking Member Brownlee, Chairman Bost, and Congresswoman Dingell. During our legislative hearing last month, subcommittee members heard from Brittany Elliott, a paralyzed veteran who utilizes a personal exoskeleton device to stand and walk. The extreme difficulties Brittany faced in obtaining this device, despite being medically eligible, are just staggering to me, and I hope my fellow subcommittee members felt similarly after hearing her testimony. Many paralyzed veterans like Brittany who have been able to obtain assistive devices have only been able to do so through extensive, extreme self-advocacy, months of delays, and hundreds of miles of travel to find a VA doctor and facility willing to meet their needs. In our recent full committee hearing on the VA's budget request, Secretary McDonough discussed meeting a triple amputee veteran who utilizes several prosthetics and assistive devices. Hearing this veteran's story and his difficulties navigating the VA left the Secretary with the quote, "The impression that there is work for us to do across the board on this issue," end quote. I'm glad that the Secretary recognizes that there are problems and inconsistencies with how VA assesses veterans and provides them with assistive devices that they are clinically eligible for. The Veterans Stand Act would work to address this by codifying and improving existing programs within VA for veterans with spinal cord injuries and disorders. This includes requiring the VA to offer annual spinal health assessments to the SCID veterans, including language directing VA to proactively reach out to those who are eligible for these evaluations, ensuring veterans are informed of and assessed for assistive technology that can help their independence and mobility, and improving transparency and accountability at VA so we can better understand where and how they may be failing in this process. The fact is, we are systematically failing these veterans paralyzed from service by denying them simple and rapid access to essential assistive technology. The status quo is completely unacceptable and Congress must act. I am grateful for the bipartisan support behind the Veterans Stand Act, as well as for the advocacy of groups like Paralyzed Veterans of America and Disabled American Veterans in support of the bill. Thank you, and I encourage my colleagues to support the en bloc. I yield back.
The chair now recognizes Representative Van Orden for 5 minutes.
Thank you, Madam Chair. I just want to briefly speak about H.R. 4424 that was put in by my good friend from New York, Mr. Lalota. It's about Vietnam veterans' liver fluke cancer study. I see that the VA disapproves this, they don't support it. I get that, and one of the reasons is that they may have to update their regulations to reflect a change. If at any time that the Veterans Administration was unwilling to do something that could potentially help one of our Vietnam veterans because they may have to take the time to update a regulation, to me that's suspect, and therefore I ask everyone to support this and oppose the VA's rather silly excuse for not doing so. Now I'd like to speak on H.R. 7347. It's my bill to amend Title 38 of the United States Code to direct the Secretary about psychedelics getting into the formulary. And again, I'm going to stress that what the Veterans Administration is doing is not working in preventing veteran suicide. We can quantify that. We have numbers. We have widows, we have widowers, we have kids without parents because they've committed suicide as a direct result of their service to our nation. We're able to sit here and have this committee hearing in peace because men and women are standing overseas protecting our lives, and we owe it to them. We just owe it to them. And I'll be honest with you, I've said this before, I am not fully sold on these psychedelic things. They are a therapeutic tool, and I'm not completely sold on them. But I'm unwilling to go to another damn funeral because we didn't try everything we could. Same reason that I think we should be using the HBOT. Same reason I think that we should look into these therapies using cannabis. I'm not sold on them completely. But if this can be a way that we can expand the universe of treatments for our veterans, who we owe our freedom to, and we can save one of them, then we should be doing it. And I also want this to be a way for us to look at some other treatments that people are uncomfortable with for some reasons, like the incredibly successful faith-based programs like the Mighty Oaks Warrior Foundation. Proven to work, changing a person because of what I view as a spiritual wound. That's what I think is the root of PTSD. I believe that. And these programs work also. So I would just implore anybody on this committee that has ever been to a funeral of a veteran that has committed suicide to remember that. And if any member of this committee would like to go with me to a veteran's funeral that committed suicide, which is going to happen, I'd be more than happy to accompany you to that funeral. And I believe that looking at these children in their eyes will change your perspective profoundly. And with that, I yield back.
Hearing that there are no other members that wish to speak on these bills, and since no amendments were filed, the question now occurs on the en bloc. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. I now recognize Ms. Brownlee for a motion.
Madam Chair, I move that H.R. 3584, H.R. 4424, H.R. 6373, H.R. 5530, H.R. 6324, H.R. 7347, H.R. 3225, and H.R. 5794 be reported favorably to the full committee.
There is a motion to favorably forward the remaining agenda items. All those in favor say aye. Aye. All opposed say no. In the opinion of the chair, the ayes have it, and the bills in the en bloc are favorably forwarded to the full committee. Without objection, the motion to reconsider is laid upon the table. I now ask unanimous consent to call up the resolutions en bloc and that resolutions be considered as read and open for amendment at any point. Without objection, that is so ordered. These are 10 small medical leases for sites, including clinics and research facilities. Each lease was requested and has a cost estimate included in the VA's budget from last year. Additionally, these leases are provided for in the fiscal year 2024 appropriations bill, which has been enacted. I urge my colleagues to approve these resolutions en bloc and advance them to the full committee. Do any other members wish to comment on the lease resolutions en bloc?
Madam Chair.
The chair now recognizes Ranking Member Brownlee.
I just have to say briefly, I will be brief, but I am so happy now that finally this committee can approve these leases. And I just want to say that this is something that I have worked on, a bill that I have worked on since I was a freshman in Congress. And I'm just so happy that it got thrown in or built into the PACT Act and now is part of our process. But this now is very similar to the process of which the House Transportation and Infrastructure Committee handles leases. I serve on that committee as well, so we're following their exact model. So I'm very proud to say this new authority, as I said, is based on a bill that I've been carrying for a long, long time, the Build a Better VA Act, and I'm excited to see this new and improved process in action today. I yield back.
Hearing that no other members wish to speak, the question now occurs on the adoption of the lease resolutions en bloc. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the lease resolutions are agreed to. I now recognize Representative Brownlee for a motion.
Madam Chair, I move that the lease resolution en bloc be reported favorably to the full committee.
There is a motion to favorably forward the lease resolutions. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the lease resolutions are favorably forwarded to the full committee. Without objection, the motion to reconsider is laid on the table. I now call up H.R. 3644. The clerk shall report.
H.R. 3644, to amend Title 38 United States.
The bill was
Code.
circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point, and I have an amendment in the nature of a substitute at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R. 3644.
I ask unanimous consent that further reading of the amendment in the nature of the substitute be dispensed with. Hearing no objection, so ordered. This amendment will be considered base text. I now recognize myself for 5 minutes to speak in support of my amendment in the nature of a substitute to H.R. 3644. This piece of legislation would extend the authorization period for emergency treatment of covered veterans at non-VA facilities under the Community Care Program. The original bill text needed some clarification as we want to avoid unintentionally narrowing the VA's current authority for when a veteran seeks emergency care. We would also like to codify the 72-hour window in the Code of Federal Regulations to be a 96-hour window of a veteran beginning emergency treatment. We will continue to prioritize making healthcare more accessible to all of our veterans, whether it's received in a VA hospital or outside of one in the community. I encourage all members to support this ANS, and I now yield back the balance of my time. Do any other members wish to comment on the amendment in the nature of a substitute to H.R. 3644? Hearing none, and since no other amendments were filed, the question now occurs on my amendment in the nature of a substitute to H.R. 3644. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute as amendment is agreed to. I now recognize Representative Brownlee for a motion.
Madam Chair, I move that H.R. 3644 as amended be reported favorably to the full committee.
There is a motion to favorably forward H.R. 3644 as amendment. All those in favor say aye. Aye. All opposed say no. In the opinion of the chair, the ayes have it, and H.R. 3644 as amendment is favorably forwarded to the full committee. Without objection, the motion to reconsider is laid upon the table. I now call up H.R. 3303. The clerk shall report.
H.R. 3303, to provide support for
The bill was
programs-
circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I don't have an amendment for this bill, but I would like to raise some concerns that I have with a section in this bill. The bill requires the Secretary to submit a report on the coordination of maternal health care, data on maternal health outcomes, and recommendations to improve those maternal health outcomes, which is already ongoing. As we know, women are the fastest growing cohort of veterans, and it's critical that we have data, like what is required in this report, to support the VA's efforts to provide the best possible health care to our women veterans. Despite this, I do have concerns about the $15 million funding request for each of the fiscal years from 2024 to 2028 in this bill. As I mentioned, this data acquisition is ongoing. Given that there was an overall increase in the Women's Veteran Health Gender-Specific Care budget request, I question the need for an additional $75 million for the coordination of care. VA's own testimony stated that their budget request for fiscal year 2024 is sufficient to implement its current authorities and programs without any additional funding. I recognize the importance of quality maternal health care, and I look forward to working to get this bill right. The bill is now open for amendment at any point. Hearing none, I will yield to Ms. Brownlee for her statement.
I really don't have a statement, albeit to say that I very much support this bill. And, GAO has found that there is severe maternal morbidity, and I think you agree on that. I think your concern is around cost, if I heard you correctly. And I believe that the funding of this bill is critically important so that we can make very significant improvements that are needed as it relates to maternal health. Happy to work with you and the committee in terms of making any kind of amendment.
Thank you, Ms. Brownlee. Do any other members wish to comment on H.R. 3303? Does any member wish to offer an amendment to H.R. 3303? Hearing none, I now recognize Ranking Member Brownlee for a motion.
I apologize. Madam Chair, I move that H.R. 3303 be reported favorably to the full committee.
There is a motion to favorably forward H.R. 3303. All those in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 3303 is favorably forwarded to the full committee. Without objection, the motion to reconsider is laid upon the table. Summarizing today's votes, the subcommittee has voted to favorably forward H.R. 3644 as amended, H.R. 3303, H.R. 3649, H.R. 4424, H.R. 5530, H.R. 6324, H.R. 6373, H.R. 7347, and H.R. 3225, H.R. 5794, and the lease resolutions to the full committee. I ask unanimous consent that the committee staff be authorized to make technical, clerical, and conforming changes to the bills favorably forwarded today. Hearing no objections, so ordered. I thank the members for their attendance today, and the subcommittee is adjourned.